Peritonitis or inflammation, infection of the peritonitis, peritoneal cavity in abdomen. So commonest infection over here, the spontaneous bacterial peritonitis in the nephrotic syndrome in the cirrhotic child, and it can be possible with the neoplastic disease, a chemical peritonitis, rupture of the hollow viscous, and with secondary cause. This is a biliary tract leak, urine leak, bladder rupture. So it is more common, more worse sort of disease, and you call it secondary, and needs a little bit different, difficult therapeutic options. Trauma and a PT catheter can also cause peritonitis. So tertiary peritonitis means recurrent, diffuse, localized disease with poor sort of outcome. So chronic, untreatable or difficult to treat sort of something is there. That's why it is called tertiary. Apart from the pain, tenderness, rigidity, these children may have your silent abdomen, low bowel sound, absent bowel sound. They can be septic, toxic with hypertension and hypoperfusion to major organs. Pneumococcus is by far the commonest offender. Can be others like Enterococcus, Staphylococcus, gram-negatives, and so forth. E. coli, even tuberculosis, Mycobacterium, tuberculosis, bovis, they are also possible. Diagnosis is by the peritoneal tap and aspiration. If you get more than 250 cells per cubic millimeter, you have a little bit less severe disease. You go a little bit with less the antibiotic and a less sort of lower ebb. But when it is more than 500, you be a little bit aggressive because the disease is quite advanced. You give 500, you give your base drug or a ceftriaxone combination, maybe cefotaxime and others. You can use the other drug according to the local and current sensitivity and go it for 7 to 14 days or so and see the clinical response. These children, they have higher amount of albumin in the peritoneal tap, and they may have polymorphic leukocytosis. They may have your CRP and other inflammatory markers higher, ESR and others, procalcitonin and others. CT scan of the abdominal CT can be diagnostic also useful, and then secondary cases should be dealt with in that way. Secondary cause, underlying cause, suppose leaking leaking bladder should be taken care of. Tertiary cases also in that way, and finally the outcome is good amount of happy. Hypoalbuminemic, cirrhotic, and then nephrotic, they are to be dealt by albumin and other infusions, and outcome may be happy if the underlying cause is not that difficult.